Let me ask you something. When was the last time you really thought about your teeth? Not just a quick glance in the mirror while brushing, but genuinely considered how your dental health affects your overall well-being? If you're over 60, you might already know that keeping your mouth healthy isn't just about having a bright smile. It's about keeping your body healthy too. Yet, dental care is one of those things that often gets overlooked as we age. Maybe it's because we're focused on other health issues, or we think that losing teeth is just a normal part of getting older. But here's the truth: losing teeth, gum disease, and chronic bad breath aren't inevitable. In fact, with a few mindful habits and a little understanding of what's really going on inside your mouth, you can maintain strong teeth and healthy gums well into your golden years. And that's exactly what we're diving into in this video series: how to keep your mouth feeling fresh, functional, and pain-free no matter your age. You'll learn why your dental health changes over time, how to protect against common issues like dry mouth and gum disease, and even how oral health connects to things like your heart, your memory, and your confidence. Before we keep going, I'd love your help with something. If you're enjoying this video so far, comment Y below. If not, comment N. It helps me know what's working and what to improve. And don't forget to hit subscribe if you haven't yet. Now let's dive deeper. Let's start with something you might not hear at your regular checkup. Your mouth is the gateway to your entire body. Literally. It's one of the most heavily populated places in your body in terms of bacteria. Some good, some not so good. When your gums are inflamed or infected, those bacteria can enter your bloodstream and affect other systems, including your heart and brain. In fact, studies from Harvard Health and the American Heart Association have shown a link between gum disease, also known as periodontitis, and increased risk of heart disease and stroke. There's also emerging evidence that poor oral health may be linked to cognitive decline. One study published in the journal Neurology found that people with gum disease were more likely to develop memory problems over time. But here's the empowering part: this isn't inevitable. You have more control over your dental health than you might think. Now let's talk about the first big challenge many older adults face: dry mouth, also called xerostomia. It may not sound like a big deal, but dry mouth can lead to serious problems. Without enough saliva, it's harder to break down food, protect against cavities, and fight off bacteria. You might notice more plaque buildup, bad breath, or even cracked lips and tongue soreness. And guess what? One of the biggest causes of dry mouth is medications. Blood pressure meds, antidepressants, allergy meds, they all list dry mouth as a side effect. And if you're on multiple prescriptions, the effect can stack up. I once knew a woman named Carol. She was in her early 70s and still full of energy. But she kept getting these little cavities and couldn't figure out why. She brushed, she flossed, she went to the dentist twice a year. Turns out, she was taking 5 different medications, all of which contributed to dry mouth. Her dentist suggested a few simple changes, like using a special mouth rinse, sipping water more often, and chewing sugar-free gum to stimulate saliva. Within months, her dental health improved, and so did her comfort. So, if you're experiencing dry mouth, don't ignore it. Talk to your doctor or dentist about it. Look into alcohol-free mouthwashes or over-the-counter saliva substitutes. Even small shifts like sucking on sugar-free lozenges or drinking herbal teas can help your mouth stay moist and healthy. Another issue that creeps up as we age is gum recession. That's when your gums pull back from the teeth, exposing the roots. It makes your teeth more sensitive to hot and cold and opens the door for decay and infection. It's not just uncomfortable, it can be dangerous if left untreated. The trick here is prevention. Brushing too hard with a stiff bristle brush can actually wear down your gums over time. So if you're still using a manual toothbrush with hard bristles, it might be time to switch to a soft bristled or electric toothbrush with a pressure sensor. These are especially helpful for seniors with arthritis or reduced grip strength. They do the work for you without damaging your gums. And while we're on brushing, let me say this: 2 minutes twice a day is non-negotiable. Not 1 minute, not 45 seconds, 2 full minutes. That's the sweet spot. If you're not sure how long that is, use a timer or hum a song you love. It makes the time fly by. Now here's something people often skip: flossing. I get it. It's not glamorous. But flossing daily helps remove food and plaque from between your teeth, where your toothbrush just can't reach. And there are easier ways to do it than wrapping string around your fingers. Water flossers, pre-threaded floss picks, and tiny interdental brushes are all fantastic options, especially if you have dental work like bridges or implants. A good friend of mine, Roger, used to avoid flossing like the plague. "It's too much trouble," he'd say. But after his hygienist showed him how to use a water flosser, he started doing it every night while watching TV. Now, his gums have never been healthier. Sometimes it's just about finding a method that fits your lifestyle. Alright, we've covered a lot already: dry mouth, gum recession, and better brushing and flossing habits. But there's so much more to explore. Next up, we're going to talk about the foods that secretly affect your oral health, the surprising link between your mouth and your memory, and how to build daily routines that keep your smile strong. Trust me, you don't want to miss it. Before we begin, I want to make one thing clear. This video is for informational purposes only and is based on publicly available research. Everyone's health is different, so always consult your doctor or a qualified healthcare provider before making any changes to your lifestyle, diet, or exercise routine. Scientific knowledge is always evolving, and what works for one person may not work for another. Alright, now let's keep this conversation going. We just talked about brushing, flossing, and that sneaky issue of dry mouth. But let's go even deeper, because your mouth isn't just affected by what you do with your toothbrush. It's also deeply influenced by what you put on your plate. Let me ask, have you ever craved a late-night cookie or sipped on juice thinking, well, it's fruit, it must be healthy, without giving it a second thought? I get it. We've all been there. But here's the deal. Your teeth don't know the difference between sugar from a donut and sugar from orange juice. To your enamel, sugar is sugar, and bacteria in your mouth love it. When you consume sugary or acidic foods, the bacteria in your mouth go to town, producing acid that eats away at your enamel. Over time, this can lead to cavities, erosion, and even infections in the roots of your teeth. And unfortunately, as we age, enamel doesn't grow back. Once it's gone, it's gone. So what can you do? Focus on smile-friendly foods, things that support your dental health rather than weaken it. Leafy greens like spinach and kale are packed with calcium and folic acid, which strengthen tooth enamel and support healthy gums. Crunchy fruits and vegetables like apples, carrots, and celery can help scrub your teeth as you chew and stimulate saliva flow, which is your mouth's natural defense system. Cheese and yogurt are also winners. They're rich in calcium and phosphate, which help remineralize your teeth and balance the pH in your mouth. Plus, they tend to be lower in sugar than many other snacks. And speaking of pH, did you know that frequent snacking can actually do more damage than eating one sweet treat and brushing afterward? That's because every time you eat, especially carbs or sugar, your mouth's pH drops and becomes more acidic. It takes 20 to 30 minutes for it to return to normal. So grazing all day means your teeth are constantly under attack. One simple trick: try sipping water throughout the day. Not only does it help wash away food particles, but it also keeps your mouth hydrated and neutralizes acids. Bonus points if it's fluoridated tap water. Fluoride is a mineral that strengthens tooth enamel and can help prevent decay. Now let's talk about something that doesn't get nearly enough attention: the connection between oral health and cognitive health. I know it might sound like a stretch, but several recent studies have found links between gum disease and memory loss, including Alzheimer's disease. One study published in Science Advances found the bacteria Porphyromonas gingivalis, which causes gum disease, present in the brains of Alzheimer's patients. Scientists believe the inflammation caused by gum disease might trigger or accelerate changes in the brain. It's not definitive yet, but it's certainly eye-opening. The takeaway here is that taking care of your gums isn't just about keeping your smile looking good. It could be one of the ways you protect your brain. And while we're talking protection, let's not forget about dentures, bridges, and implants. Whether you've had a tooth extracted or were full dentures, your oral hygiene still matters a lot. A surprising number of people think that once their natural teeth are gone, their dental worries are over. But artificial teeth still need cleaning, and your gums and soft tissues are still at risk for infection, irritation, and disease. Take my neighbor George, for instance. He's 76 and has had full dentures for over a decade. For years, he just gave them a quick rinse at night and popped them back in every morning. Eventually, he started experiencing sore spots and a strange taste in his mouth. Turns out, bacteria had built up under his dentures and were causing a fungal infection called denture stomatitis. It's more common than you'd think. Now George soaks his dentures in a special cleaning solution every night and lets his gums breathe while he sleeps. He also makes sure to gently brush his tongue, cheeks, and gums with a soft toothbrush to keep his mouth clean. The difference? Night and day. So if you wear dentures, here are a few must-dos. Clean them thoroughly every day. Take them out at night. Visit your dentist regularly to make sure they still fit properly. Your gums and jawbone can change shape over time. And most importantly, don't assume you're in the clear just because your teeth are artificial. You still need routine oral care. By the way, regular dental visits are one of the most powerful things you can do for your health. And I know they're not always fun. Maybe you've had a bad experience in the past, or the cost makes you hesitate. But early detection of problems like cavities, oral cancer, or gum disease can save you from bigger, more painful issues down the road. Some community clinics and dental schools offer reduced cost services if you're on a tight budget. Medicare usually doesn't cover dental care, but many Medicare Advantage plans do, so it's worth checking into. And don't be afraid to ask your dentist about payment plans. They're more common than you might think. So far, we've looked at the mouth-body connection, smart eating habits, and why dental visits matter. You're probably starting to see how all of this ties together. Taking care of your mouth is about so much more than appearances. It's about protecting your confidence, your comfort, and even your long-term health. But I know it's not always easy. In the next section, we're going to tackle the real-life challenges that come with maintaining dental care routines as we age. We'll talk about motivation, physical limitations, and how to build simple habits that stick, even on the tough days. You've made it this far, and that already says a lot about your commitment to your health. So let's keep going. What you learn next might surprise you, and it just might change how you feel about your next trip to the dentist. You know, keeping up with dental care as we get older isn't just about knowing what to do. It's about making it part of your daily life, even when things get tough. I want to share something personal here. A close friend of mine, Susan, struggled for years with brushing regularly because of arthritis. Simple things like gripping a toothbrush became painful, and eventually, she started skipping her evening routine. At first, it seemed like a small issue, but soon, she noticed her gums bleeding and a constant bad taste in her mouth. That's when she decided enough was enough. She switched to an electric toothbrush with a larger handle designed for people with grip difficulties. That small change made brushing easier and even kind of fun. Susan also began using floss picks instead of traditional floss, which helped her clean between teeth without the hassle. And for dry mouth, which can make brushing and eating uncomfortable, she found relief in chewing sugar-free gum with xylitol, a natural sweetener that actually fights cavity-causing bacteria. Her dental visits improved too. She talked openly with her dentist about her arthritis and oral care challenges, and together they crafted a care plan that suited her needs. Now her gums are healthier, and she feels confident flashing her smile again. Stories like Susan's remind us that aging brings challenges, yes, but also solutions, often simple ones, when we're willing to look. Let's talk a bit more about the mindset needed to maintain these good habits. It's easy to feel discouraged if progress seems slow or if setbacks happen. But every small step counts. Think of your mouth as a garden. If you don't water it or pull the weeds, it won't flourish. But with patience and consistency, you can see real growth. One powerful motivator is to remember what good oral health does for you beyond just teeth and gums. It affects your ability to eat well, speak clearly, and maintain social connections, all essential to quality of life as we age. Science backs this up. Research published in the Journal of the American Geriatric Society found that older adults with better oral health reported higher overall well-being and lower rates of depression. And here's another nugget that surprised me. Maintaining good oral health may even reduce your risk of cardiovascular disease. A study in Circulation showed that people with gum disease had a 20% higher risk of heart attack and stroke. The link seems to be inflammation. Gum disease triggers inflammation throughout the body, which can affect your heart. So in a way, brushing and flossing are small acts with huge ripple effects. Now what about those times when motivation dips or physical issues get in the way? Here are a few tips that have worked for many. Set a routine. Try to brush and floss at the same times every day, so it becomes second nature. Use reminders, whether it's a note on the bathroom mirror or an alarm on your phone. Celebrate progress. Even if it's just brushing one extra day in a row, acknowledge it. Or reach out. Sometimes talking to a friend, family member, or dentist can help you stay accountable and get support. Another challenge that many face is medication side effects. Older adults often take multiple medications, some of which can cause dry mouth or changes in taste. Dry mouth isn't just annoying. It increases your risk for cavities and infections because saliva helps wash away food and bacteria. If this sounds familiar, talk to your healthcare provider about possible alternatives or saliva substitutes. Drinking plenty of water and chewing sugar-free gum can also help. And don't underestimate the power of hydration. Sometimes just increasing water intake makes a noticeable difference. Lastly, if you're dealing with dentures, implants, or bridges, remember these also need care and attention. Regular cleaning and checkups prevent issues like infections, bad breath, or gum irritation. And if you notice any discomfort or changes in fit, don't delay seeing your dentist. The bottom line? Aging is natural, and it comes with changes, but your oral health is something you can influence every day. With the right tools, support, and mindset, you can keep your smile bright and your mouth healthy. In the final part, we'll wrap everything up and talk about easy, actionable steps you can start taking today. We'll also share some inspiring takeaways to keep you motivated on this journey. You're doing great by being here and learning. I can't wait to finish this together. Let's take a moment to look back at everything we've explored together. We started by understanding why dental care is so important as we age. How it's not just about a pretty smile, but about protecting your overall health and quality of life. Then we dug into practical tips: brushing well, flossing, managing dry mouth, and choosing foods that support your teeth and gums. We also saw how oral health connects to brain health and even heart health, which might surprise many people. We shared stories of real people like Susan and George, reminders that no matter the challenges, small changes can make a big difference. Whether it's switching to an easier toothbrush or soaking dentures every night, those steps add up to healthier mouths and brighter days. Here's the empowering truth I want you to hold on to. You are in charge of your oral health. Every day is a fresh opportunity to make choices that protect your teeth, your gums, and your whole body. So, what can you start doing right now? Try this. Tonight, after dinner, take a few extra minutes to brush gently but thoroughly. Use a soft brush. Maybe try one of those electric toothbrushes if gripping is tricky. If flossing feels difficult, start with floss picks or water flossers. They're game changers for many people. Sip water throughout the day to keep your mouth hydrated and help rinse away food debris. And don't forget to schedule or keep up with your dental checkups, even if you think nothing is wrong. Prevention is your best friend. Remember what the Journal of the American Dental Association highlighted. People who maintain regular dental care experience fewer health complications and report better quality of life. If you take just one thing from this series, let it be this: your mouth is a gateway to your overall health. Treat it kindly, and it will serve you well for years to come. We'd really love to hear from you. If you have any suggestions for future topics or questions you want answered, write to us in the comments below. We're here to help, and your input could inspire our next video. And if you found this video helpful, give it a thumbs up and subscribe so you don't miss out on more practical tips for healthy aging. Here's to living your best life at any age.